A bustling laboratory, the clinking of glass, the hum of machinery. In this space, an intricate dance of science and art unfolds. This is the world of pharmaceutical formulation. So, what is formulation? Simply put, it is the process of combining various chemical substances to create a final medicinal product. This delicate process plays a key role in the pharmaceutical industry, balancing the need for therapeutic efficacy with patient acceptability. Now, imagine a tablet. This seemingly simple dosage form is in truth a complex blend of various ingredients, each playing a unique role. These ingredients, often referred to as additives, are integral to the formulation process. First on the list we have diluents. These substances serve to bulk up the formulation, making the tablet a practical size for patients to swallow. Common examples include lactose and microcrystalline cellulose. Lactose, owing to its excellent compressibility and cost-effectiveness, is a popular choice. Microcrystalline cellulose, on the other hand, is renowned for its excellent binding properties and compatibility with a wide range of active pharmaceutical ingredients. Next up, we have sweeteners. As the name suggests, these additives make the medicine more palatable. Sweeteners like sucrose and aspartame are commonly used. Sucrose, a natural sweetener, is often used in chewable tablets and syrups. Aspartame, a low-calorie artificial sweetener, is a preferred choice for sugar-free preparations. Then we have binders and adhesives. These substances hold the tablet together, ensuring it doesn't fall apart before reaching its destination. Examples include starch and polyvinyl pyrrolidone. Starch, a natural polymer, is an excellent binder, providing good hardness and friability to tablets. Polyvinyl pyrrolidone, a synthetic polymer, is known for its excellent binding and disintegrating properties. Moving on, disintegrants are the unsung heroes of tablet formulation. They ensure the tablet breaks down into smaller particles once in the body, allowing the active ingredient to be released. Common disintegrants are cross-carbamylose sodium and sodium starch glycolate. Both these substances swell in the presence of water, causing the tablet to break apart. Lubricants make the manufacturing process smoother by preventing the tablet from sticking to the machinery. Magnesium stearate and stearic acid are popular choices. Both these substances have excellent lubricating properties and are compatible with a wide range of active ingredients. Anti-adherents and glidants improve the flow of the powder mix during the manufacturing process. Talc and silicon dioxide are commonly used. Talc acts as an excellent anti-adherent, preventing the tablet from sticking to the punch faces of the tablet machine. Silicon dioxide, on the other hand, acts as a glidant, improving the flow properties of the powder mix. Understanding tablet formulation is not just about the science, it's about appreciating the art behind this intricate process. It's about understanding how each additive plays a role in shaping the final product. It's about realizing the delicate balance between therapeutic efficacy and patient acceptability. For those in the pharmaceutical industry, mastering this balance is the key to creating safe and effective medicines. So the next time you hold a tablet, remember the science and art that went into its creation. Voiceover. As we continue our journey into the world of tablet formulation, let's delve into two critical aspects: powder flow and air entrapment. These may sound like complex terms, but they're simply characteristics of the powder mix that can greatly influence the final tablet's quality and uniformity. First, let's look at powder flow. This refers to how well the powder moves or flows during the manufacturing process. One way to measure powder flow is through the angle of repose. Imagine pouring a pile of powder onto a flat surface. The angle that the pile makes with the surface is the angle of repose. The smaller the angle, the better the flow of the powder. This is crucial in ensuring that the powder mix fills the tablet mold evenly, leading to a uniform and high-quality tablet. Now let's move on to air entrapment. This is all about how much air gets trapped within the powder mix. To measure this, we use the concepts of bulk and tap density. Bulk density is the mass of the powder divided by its volume, including the air between the particles. Tap density, on the other hand, is the mass of the powder divided by the volume after it has been tapped or compacted. Comparing these densities can give us an idea of how much air is trapped within the powder. Minimizing air entrapment is key for achieving a consistent and robust tablet. By understanding and controlling these properties, scientists can ensure the uniformity and quality of the final tablet. So next time you pick up a tablet, remember the intricate science behind its smooth, uniform appearance. Voiceover. After we've examined the powder flow and air entrapment in tablet formulation, let's move on to the next crucial steps: tablet compression and coating. Compression is where the magic truly happens. The powder mix is fed into a tablet press, which applies a tremendous amount of pressure to compact the powder into a solid tablet. There are two main factors to consider during this step: the compression force and the dwell time. Compression force is the amount of pressure applied to the powder mix, while dwell time is how long the pressure is applied. Both need to be finely tuned to ensure the tablet is neither too hard nor too soft. Once the tablets are formed, they undergo a process called coating. This involves applying a thin layer of a special coating solution to the tablets. The coating serves a dual purpose. It enhances the tablet's appearance, making it more appealing and easier to swallow. More importantly, it can help control the release of the medicine, ensuring it gets to the right place at the right time in your body. The coating process requires careful control of factors like temperature, coating solution concentration, and coating time. So the next time you take a medicine tablet, remember the precise science and art behind its creation. It's not just about what's inside the tablet, but also how it's put together and presented to you. End note. Don't forget to like, share, and subscribe for more fascinating insights into the world of pharmaceutical formulation and beyond. Stay curious, stay informed.